Hi, everyone. Welcome to Empowered with Gina from ZA Ranch in Louisiana. Today, I'd love to introduce you to my dear friend, Lizette Alvarado. Welcome, friend.
Thank you for the introduction and thank you for having me. I'm super excited to be here.
So I wanted to invite Lizette because not only is she like a wonderful friend and a girl's girl and a super mom and a super boss and a boss babe, etc., but I wanted her here because it's a very special conversation to have with someone like her who is doing it all, going through the highs and lows of business, of life, of professional, of personal, etc., but doing it and just making it happen. So, friend, I always start this podcast off 3 adjectives that describe yourself.
Fun.
Yes.
Giving.
Yes.
And kind.
All true. Okay, where did Lizette grow up?
So, I was born in New Orleans,
Okay.
and then my father's a physician, so then we traveled to Dominican Republic, Santo Domingo, and we lived there for a couple of years in by Haiti. He did his tropical medicine internship.
Wow.
We then moved to New York and New Jersey for a couple of years. But my mom originally was born over here in Louisiana. So she wanted us to come out here and come back home and settle to the beautiful home state of Louisiana, which I love. The food, the culture, the people here is so different than anywhere in the world.
I know.
This is our home, right?
Oh.
So we settled back here in little Mandeville. So that's where the roots were, in Mandeville. I went to high school out that way and began. And then I went to medical school. And I was married and I got pregnant unexpectedly. And
my goodness.
Yeah, so I had my first son who will be 18. He was very unhealthy when he was born and had to have surgery. So my life took a different path. So at that point, I stopped medical school, sat back, and then went to nursing school after I got my son stabilized. He's fine now. Just so everybody knows, Enrique's good now. But I then, took another path that God guided me to. And so I went to nursing school and then grad school for nurse practitioner. But I have lots of experience in the medical field since I was a kid, going into surgeries with my dad since I was 8 years old, traveling through, third world countries with him. And so 16 years for myself in medicine, doing hospice and palliative care, hospital medicine, urgent care. So my whole practice is built on having all these experience of different sets of life from 0 to 100. I've dealt with pediatrics to geriatrics to end of life and death. And so I wanted to bring all of that together. And that's where my whole beginning comes from.
And so you come from a medical family, so you very much keep it in the family business. Yes. Where's dad from?
So dad's from Nicaragua. Managua, Nicaragua. So he's Latino. So we bring that Latino culture to this town. Yeah. We're the only one and first only med spa on the North Shore with the Latinos present. So we're a part of the Ola North Shore. So we take care of a lot of the farmers and the immigrants and we're able to speak Spanish and dad can translate for primary care because that's very difficult. If you can't speak English and you are sickly and you have thyroid, cardiac, diabetes, and they give you all these medications and you have no idea how to take them and it's all in English.
You don't even know how to communicate your symptoms to the doctor. So the quality of care that your dad and you in your office are able to give to non-English speaking people, it makes all the difference in the world in the outcomes, as you know.
Correct.
Because they feel familiar.
Yes.
I don't have to try to say or find a word and they're embarrassed, they're shy, they're scared, and they don't feel good.
Exactly.
So it's tremendous that you and your family are able to provide that.
Thank you.
Before we get into your current business, talk to me personally. Where are you? How many kids do we have? What's happening here?
Yes, so we have 4 together, David and I. So my first marriage, I have 2 kids. He'll be 18 and Izzy is 14.
Okay.
And David and I have Jonah together, who's 3 years old.
Baby Jonah.
So I started all over again, you guys, all over. 36 years old, third baby for me.
Wow.
And it's just very invigorating. And then we have Drew, who's 13, is David's son. So we bring blended family together.
The best.
That's our little family life. And a good bit of our family from Nicaragua is out here.
Really?
So so it's interesting that a lot of them live out here. So it's great to have that family connection.
Okay. So you've stayed in the area. Mm-hmm. You went to nurse practitioner school and then you were working in the hospitals and different facilities. Tell me where the idea for your current business, what your current business is, where the idea came from and where it is today.
So it all stems from my mom. My passion. I lost my mom 2.5 years ago, but she was always about skincare and Botox and wellness. And so I always wanted to do that in my heart. And I knew that because I always loved fashion and beauty, and it's fun, exciting.
So fun.
and to make people feel good.
Yeah.
And to have a different approach where it's holistic, integrative, and medical and aesthetic all in one place. And so I started, 4 years ago, investigating, building, getting education, traveling, and finding where I want to be. And so when my mother passed away, that was my big drive to take the step. And so the business starts with the whole butterfly. And so metamorphosis and growth. We all change. We're all like that little caterpillar through life, right? And as we come out of that cocoon, we all have failures. We make mistakes. And we grow to the beautiful metamorphosizing butterfly. And I can help you achieve that. So my idea was to bring you in, give you a safe space as a patient. Men, women, from all ages, going through menopause, if you need Botox, if you have primary care issues. I wanted it to be a one-stop shop. That was my idea. So I started that and I called it SYN, meaning in synergy. So synergistic care.
SYN.
SYN, not SIN, you guys, because we get a lot of jokes about that. And so I'm
It's
like,
okay, you won't forget it.
yeah, exactly. People say, are Christians allowed there? No, and I'm like, of course they are. And they're like, what are y'all sinning over there? I'm like, no.
That's funny.
Yeah, so out here in the South, it is funny to have a name of SYN. It's unique, but it means in synergy because we do everything. We do the primary care, concierge medicine, urgent care. I drained a cyst from someone the other day, all the way up to aesthetic medicine. So you can come in there and have that holistic approach.
Oh my gosh. And you had this innovative idea because you have leverage that most people don't have. Most nurse practitioners need a licensed medical doctor, an MD, to be able to do the primary care treatment, to be able to do certain procedures or treatments, right?
Yes.
You saw the leverage that you had. Explain that part to me.
Yes. So it took some time for my father to get into this, though. My dad is the medical director, Dr. Alvarado. And so when I first went to him a couple years ago, he's like, we're not doing Botox. That's going to make people's faces fall off. We're not doing this. I'm not doing this, he said. It took several years. And then finally, he loves it. Now he's like, I want to do it. I want to inject people. But that's where I thought about the plan. I thought the best plan is to marry and bring that together. My dad has almost 40 years of primary care experience.
So smart.
Treating thyroid, diabetes, so he takes care of cardiac conditions and he does, a lot of things there that are different than other physicians. And he has a lot of knowledge and skill behind him. He sits on the board of directors. He's been ACP president delegate. So he's a highly established physician, very involved. Yeah. And I knew that was great for our patients. So I brought that together. He comes into the office. So we have a physician always present, and that's what sets us apart. And so, so he brings all his knowledge, and we're able to filter patients back and forth. We refer to each other. So it's a wonderful union.
It's beautiful.
And his wife's a pharmacist. So we also have a pharmacist on staff.
Beautiful.
Yes.
One-stop shop.
Correct.
I love that. Keep it in the family. You diversified, but we're able to see the leverages that you could bring together under one house.
Correct.
And what is so interesting is that you're not just like a med spa. And I know because a lot of our family goes to you and your dad. And it is really the whole wellness, the whole body. You're not just like, let me inject you for the vanity reasons. Like I'm all about being vain, 100%. So there's that. Yes. I love that part.
Yes. Oh, yes.
But I know, and I've seen you do this in the past where you say, you know what, we can't do that with your like family member who wants to see me. They want to come in for this one treatment. But I think we need to check them out first because I've noticed some things that maybe they're not even noticing. Right. You gave them a battery of tests, and sure enough, you realized they had certain things that you were able to help them with, but you're not just like, come in and get injected, come in and do this. Like you offer fully the whole body, whole mind package. And so I appreciate that you create that and are able to do that. As a CEO, as a founder and a business owner and a mom and a wife, how do you do it?
It's a hard balancing act.
Yeah.
There's always going to be something out of balance. We balance everything, but the one thing I always make sure is that my cup is full. It's all about self-fulfillment, self-awareness. We have to make sure that we can give back. If we're not filling our cup, it will be empty. We'll be resentful. So I always try and make sure my cup is full.
How?
Through spirituality, through self-happiness, doing the events that I want to do, going with my friends and going places and having family time. You've got to have that because sometimes people will say, how are you going to all these events and managing your family and doing the business, doing it all? Yes. And I'm enjoying it all and it fills my cup and it motivates me and it helps me give that self to my highest self so that I can give back to the community, my children, my family, my patients.
Mm-hmm.
So I balance it out. But there's always going to be that one thing out of balance, like the dishes or the laundry. So, I always have help and maids and things like that help. But it's a balancing act, indeed.
What do you do with the feelings of guilt when you're either you feeling guilty or imposter syndrome about the business or family side, or if you're not feeling good enough? Because we all go through it.
Right.
How do you talk yourself out of that or through it?
I start thinking about the positive sides. I try and stay away from negativity, because if I go into guilt, I start thinking about that and I get negative, and I try and stay away, because we're all going to have that negative
All of us.
thought process, and we're going to feel guilty. I spent this much time here and not enough time here. And then I look at it and I'm like, no, I'm going to spend that time here. I'm going to manage my time and make sure my family has my divided attention.
Yes.
Along with the business. So I try and talk myself out of it. I meditate. I pray. I find that spirituality, whether some people have that divine or God, whatever they call it, that supernatural being, because we need that fulfillment. I pray, I meditate, and I think about it, and I find that growth, and I go forward. I try not to fester on it, because when you fester on things, it just grows. So I think about it, and I let it go. And I try not to feel that guilt. And try and enjoy it. Correct.
What do you see as trends in your business with women and men aesthetically? What do you see some trends that are happening that you really like, that are new, recent? Like, what are some of the things that are really trending right now?
So our natural skin.
Yes.
So a lot of girls are like going natural with their skincare.
So good.
Yeah, and not wearing makeup. Right? You want to just be beautiful as yourself. And so I see a lot of women come in, they're not wearing the makeup. They're wearing the tinted sunscreens with a little bit of a clear lip gloss. Natural, beautiful. But there is also the trends of, okay, we need our Botox. We all need
our Botox.
We have to.
Always.
We need to prevent wrinkles.
It helps us look natural.
Yes, exactly.
Looking natural is a lot of work.
Thank you.
People don't get that.
Correct.
I don't want to do all that to my face. Well, then I don't know what you think you're going to look. I know the look you're going for. You need to get some Botox and some extra help from Lizette.
Correct.
She will help you get that natural look.
Yes. In order to get that natural look, it does take work, though.
Yeah.
Skincare can take 3 to 6 months before you see the results. But you should have an SPF, a vitamin C, right? A hydrating HA, and you can use some growth factors. But you definitely need to have those few things in your skincare kit.
Yeah.
Everyday SPF, skincare, preventing skin cancer. The Botox is going to help the wrinkles from becoming deeper.
Sure.
Helps your makeup settle. It sits softer. It blocks the acetylcholine receptor so you don't sweat.
Yes.
You don't have as much acne.
Yep.
So it does help. And then fillers to help with facial balancing, peels to help get rid of the melasma, the dark skin spots, hydrofacials, diamond glows, things like that. It's important to take care of the skin so that you can rock that natural look with the tinted sunscreen and lip gloss.
That's my favorite.
Yes.
Okay. And then what would you say, because you also have the primary care health side of it all, what are some things women at 30s, 40s, 50s, what are some things we should annually be doing, annually be checking on as women?
Okay. So as women, it's important that you see your primary care doctor at least twice a year.
Oh,
you
twice?
need to have, twice a year at least to have labs. Mammograms are huge.
Massive.
So
I just had mine last week.
Yay! I'm so happy.
All clear.
Perfect.
Yay.
So mammograms are huge because we need to prevent and we need to screen to make sure we detect things early. So
take care of it early.
Correct. Pap smears with your OBGYN.
Yep.
Right? Your mammograms, labs, annually, if not biannually.
Really?
Yes.
Labs for what?
So we need to check our holistic, our whole metabolic panel, our CBC. Our metabolic panel looks for kidney function, our electrolytes. We need to look at our liver as well, call that hepatic function. CBC looks for anemia or blood disorders, right? Or if you're having allergy or things like that. Because as women age and we're headed into menopause, our periods can sometimes get heavier. Or if you have fibroids, so you become anemic. And if you're fatigued.
You just can't figure out, why am I always so tired? You're not tying one thing to the other.
Exactly. Exactly. Thyroid is huge. So women need to have at least a CBC, a CMP, a thyroid.
These are all tests.
Liver. These are lab tests.
And primary care doctors would know this.
Yes.
So what should a woman go in? The doctors will know this, but maybe just for their own knowledge, what should they ask for?
They should ask for, an overall comprehensive lab panel.
Okay.
With thyroid, liver, make sure that their heart's okay, checking your lipids because you want to see what your lipids are and you want to prevent coronary artery disease and get on the correct medication so that way you don't have any coronary artery disease instances.
Oh my gosh.
Yeah.
And the tools are there.
The tools are there.
The tools are available.
Your health is your priority. Without health, you have nothing in life. Health is wealth. So you have to stop, even when you're like, I'm too busy. I can't get to the doctor. I don't have time. How are you going to have time to live and survive and take care of your family without health?
But they'll get their nails and their hair done.
Yes, exactly.
You won't miss those appointments, will you?
Exactly. So prevention is key. Getting in to see your primary care doctor.
Just do it. Get it over with.
Do it, you guys. Health is wealth. Because when you don't feel good, you cannot work.
And sometimes it's too late.
Correct.
If it's not cancer, hopefully it's not. But if it's another disease or some cardiovascular issue, then it's going to take some time, if at all, to get healed and back to normal.
And get you referred and things like that. Like I myself have lupus. I've had it since I was 8 years old. And my aunt passed away at 15 of it. That's from the Cuban descent. So I always knew that I had to prioritize it in order to stay healthy and feel good. I don't always feel my best and I'll have my sick days, but I keep powering through. I make sure I see my doctors, take my medications, because when you take your medicines, see your doctors, you make sure you feel good.
And you manage it.
Yeah, and you manage your health and take care of yourself and you'll feel good even though you may be sick.
You see? Well, my friend, I love you and I thank you for coming here. You really are an inspiration and you're one of my closest friends here in Louisiana and have always been very open and welcoming. Your whole family has been. And
Thank you.
I just really applaud you leaning into your space. You go for it. And that's when we started. I said, you do exemplify, heading straight on into the risk and the fear and the insecurity of business and life and all of it. And it ain't easy.
Right.
We've talked and we know, the hiccups that come, but that's part of it.
Yeah.
And, it fills me with joy to see you taking advantage of this privilege and creating it for yourself. So thank you so much for being my guest.
Thank you for having me. I love you, Gina. You have totally transformed me. You have taught me to be empowered, to have a no tolerance lifestyle. I'm going to do this and I don't care what anyone thinks.
That's it.
And we're going to live our best life and have a good time.
And we'll go back to Italy together.
We're going to Italy, you guys. This time I think Amalfi Coast. Am I correct?
Amalfi Coast.
Yes. Aperol Spritzers, here we come. Here we come. I'm so excited.
See everyone next time.
Bye. Thank
Bye-bye.
you.